Dr. Malone, it's April the 8th. We're into our 4th week at the firm of working remotely. Amazingly, we still hadn't missed a beat in regards to representing our clients. We've still been able to use the remote facilities like Zoom and FaceTime to not only have hearings this week, but to also meet with clients. And fortunately, we've also been able to use Zoom for this purpose, which is bringing information from you as a board-certified internal medicine physician to the local community here to discuss the different things in the news, basically. So if you could go ahead and just tell us a little bit about what happened today, both locally and nationally, and perhaps internationally, that are significant from a virus standpoint.
Okay, well, so the first thing that I think was significant locally is, last night we had gotten the news the time we were on here about the long-term care facilities in Escambia County, going from basically 1 documented infection to 8, and now again this morning it's just 16. That to me is probably the big news, the biggest news, and we'll get into that here in a moment. To just round out the rest of the numbers here, locally we went from 168 last night to 182 in Escambia County, with 16 people hospitalized since the start of this all. Yesterday was 15, and now 3 dead related to the again yesterday. So that's the local trend there. And the good news is we're, I think, starting to see some of the tracking as far as social distancing scoring. So we've been, hanging in like the C- D range, I told you every time. And first time that I've been following this now for almost 2 weeks, Escambia County is a B based on the most recent data, which basically includes the entirety of this past weekend into Monday. Like I said, there's about a day or so lag there. So hopefully that's the manifestation of new orders that came down last week. We're saying, okay, we're gonna stay at home. So we're a B. The state as a whole is an A-. So I like seeing that. Hopefully that translates into something more measurable as far as positive cases, or just diminished need to test. Maybe the symptoms aren't even there. So that's one measure. So that's the numbers there. As far as getting back to that long-term care facility, if people remember, that's really the thing that really scared people when the state of Washington numbers were coming out, was the one nursing home where basically, it was like 40 some people ended up dead. And we mentioned this last night, where, really was a tinderbox. Well, one person introduced it in there, and you have people who are the classic profile for being immunocompromised, having some other comorbid condition, having against them, meaning they're all over the age of 65, and then the relatively sedentary lifestyle. So that's the perfect crop for a virus to take advantage of. So just like last night, I have some of that you can look at and kind of apply it to what we're looking at.
Have they identified this facility?
No, and I've been trying to read as many news briefings as possible, and I have not been able to find which facility it is. Most of the mentions are.
This facility would have had the benefit of all the stuff that happened in Washington State with that facility. You would think that they would have locked everything down at that point and made it ultra hard to get in these places. If other than staff, I wouldn't think that anybody should be allowed in those places. And even the staff should go through, I would think, rigorous kind of testing procedures, and still exercising the PPE stuff that even the folks in the ICU are exercising. That would be the kind of level I would think they would be working with. Am I wrong to say that?
No, you're absolutely right. And let me share this real quick, and then we'll go into some of those recommendations. So this is from the Seattle region.
That's the one that you referred to.
Hold on, let me get the different one up that I had here. just a moment here. The long-term care facilities. Apologies for that. So Joe started off by saying we're going swimmingly here with our teleworking in here.
You are swimmingly. It's just
Yeah.
you had one up from last night. That's all.
Yeah, no, yeah, it's still loaded in there. Let me get this pulled up here just a second.
I was paying attention at least last night to recognize the article.
Let's see here. Let me get it. I'll link it over to myself real quick while we're talking.
Sure.
And
well, this thing
in
about Zinc
relation
came
to
up, and I know that the president throws curveballs to you right before we get on the air here, but
yeah.
tonight he was a little more cautious about the hydroxychloroquine, but he also threw zinc in there. I guess we can talk about that after you talk about this. But what is it? What are we looking at now?
Yeah. So this is there's a link we'll share again tonight, like we've been doing with everything else. And so this is a pretty good decision or guidance module, and it's meant for professionals as well as the public. So we'll link this on here. So I'll drive it. So if we're looking for preventative advice for individuals, I'll click on that one there. We're going to set from care facilities, right?
Right. This is what they should have been doing.
This is the top to bottom.
Restrict all visitation except certain compassionate care situations, end of life. Make decision end of life on a case-by-case basis. Restrict all volunteers. Cancel all group activities. Screening of residents for fever. Create plan. Oh, so that all this has been available to these long-term care facilities since when? Since 2 weeks ago, 3 weeks ago? How long?
I can't speak. I mean, this is constantly being updated. So this is the current recommendations as of today. So not to cast any blame and say, oh, we shouldn't have even gotten to this point. You'd like to think moving forward, if we're at 16 locally, like, man, we got to do everything on this list to try and keep it at 16. And it's a pretty expansive list.
16 of those people, are you saying 16 of those people in that facility have COVID?
There are 16 that are linked to long-term care facilities, be it a patient that admitted living there, and then staff and or visitors who have been somehow tied to the facility. Do we know if it's the same long care facility or if it's a different one? That hasn't been released either. So we don't have the breakdown of which individuals it would include as far as personnel, visitors, or I guess the inhabitants. And then we also don't have which facility. And when questioned today, the county officials, I guess, punted or referred to this Department of Health as it being a HIPAA issue and answering that question when the time is appropriate. My understanding is that it was communicated to the family members of the loved ones or relatives that are admitted to these facilities. What would you tell the family
if the family members are notified that their relative is in one of these places that has an outbreak, if you will? What would you advise? What would you advise those family members to do as far as communicating with the facility about how best to protect their relative who's in the who's in the long-term healthcare facility, where another resident has been hospitalized or has come down with the virus? What would you tell those family members to do?
I would questions of the administrators or the head nursing staff or the medical directors to say, is there a protocol in place? We looked at a protocol last night with regard to hospital admissions. You guys have to have a protocol, and does it reflect something like what we're looking at here? And if they didn't have that kind of a protocol there, I mean, putting the doctor aside, I mean, I don't want to get my loved one.
Is it safer to bring those people into your house at this point? I mean, what do you do with your relative that's in these places that have infections going on?
Yeah, absent a protocol or a plan in place that it resembles something like what we're looking at right now. I mean, again, I'd have to set aside the doctor part and be like, I'm going to get my loved one, and I'm bringing them home with me. I mean, I have to be at home anyhow, and I'll institute these measures.
But do you want to make sure that loved one doesn't test positive first before you bring them to your house? Practically speaking, do you want to bring the infection into your house? And I mean, I'm not sure how you handle that. Do you get them tested first?
Well, I guess you could get them tested because they've had an exposure. Ideally, the testing is going on already, and
Right.
so you here and then you put them under like a self-isolation protocol. So kind of like last week when we mentioned that the mayor's son tested
Right.
positive, so the mayor got tested appropriately so, and in the light of a negative test, he was going to practice the isolation. So do you isolate your loved one when you bring them home? So I guess it could get that extreme, but I don't think that there's any real firm guidance as to what to do. And it'd be, I think that decision would be driven mostly on emotion and passion than anything. And you'd have to be saying, if something bad's going to happen, I want it to happen when I'm here and I can be with them, as
Right.
opposed
Right.
to locked up in a place where you don't have any control over who's coming or going, perhaps, if a protocol like this is not in place. So anyhow,
I
let
think
me,
that's good
I
advice.
have this other thing linked up. I apologize for not having it there, but this is the data from Seattle, and it puts some numbers again on something that we were looking at. Um, so here's the long-term ability. You can see why I thought it was the same one. They're like the same publication, they're both New England Journal.
Oh, they
So
do.
this is
They
a
do.
long-term care.
Yeah.
Yeah, so
Okay.
it's a New England Journal long-term care facility, state of Washington. And so if you get to the numbers here, at 167 confirmed cases affecting, the breakdown was 101 residents, 50 healthcare personnel, and 16 visitors. So that's what I was saying, like, okay, we have 16, what's our breakdown? And it's not released yet. So then they tell you what the hospitalization rates were of those people. So 50% of the residents got hospitalized, 50% of the visitors got hospitalized, and 6% of the staff got hospitalized. And I guess you would operate under the assumption that the staff are younger and healthier. So, the visitors, you think, okay, well, it's a husband, a wife, or vice versa, and so they're the same age and maybe have the same comorbidities. Maybe just there's a reason why one or the other is admitted to this facility for rehabilitation purposes, or other, maybe if there's like some dementia involved, things like that. But everything else is the same. So that's why those numbers are close to the same, I would surmise. As far
Mm.
as the fatality, 33% of
Yeah.
the residents died.
That's pretty scary.
I mean, yeah. So that's what we're talking about. So when I say
Right.
this is a tinder box, I mean, and I'd hate to see this number double 10 and it's 32. And then, well, dang, of that 32, are we looking at 5 or 10 more deaths now?
Right.
So I think that of all the things that I've seen locally, every time I see these numbers double, I've been doing this for weeks now, it hasn't fazed me. And even when we started seeing like 1 death or 2 deaths or 3 deaths, not to minimize those, but to see this is the thing that I'm like, ugh, this is not good news.
This is where you really mess up. Are there any other
Yeah.
stories around the country of long-term facilities, long-care term facilities getting this kind of situation like it looks like we have here? Or is Seattle the only other place?
Well,
Some,
Seattle's the canary line, the first one that really scared everybody. I don't think that we have any publications out of like the single facility that had that many deaths or anything like that. But without the Seattle one, I don't think that we would have been paying attention to these numbers quite so much right now. I don't even think they'd be reporting them. So I guess there's a benefit of the Seattle incident to say.
I know, but I would just think that if there was other long-term care facilities in the country that had positive, let's say they had 7 or 8 positives, that would make news. And it just seems surprising to me almost that all these other facilities around the country have been able to keep this virus out of their facilities.
Yeah, and well, I think one of the hotspots, we showed that map the other night where there was like the hotspots you don't know about. They're not the Miamis or the New Yorks or the LAs. Well, one of them was, besides New Orleans, was Georgia. So if you look at that map, there's a red spot in the southeastern corner of Georgia. And that's a long-term care facility link.
What city is that again?
Albany.
Oh yeah, I heard that because they had some funerals or something that a lot of people went to over a couple of days, and the funerals themselves actually gave rise to the spread of the virus in those communities. Is that right?
And I think that there was a long-term care facility of some sort that was tied into that whole, I guess, if you will. So that's the only other one that comes to mind. And I've been trying to keep up on the news. I anticipate
other than this long-term care facility situation, there's medical legal issues all in that, by the way. But what else is going on news-wise with the virus locally, numbers-wise, I guess?
Locally, so our percentages in the Escambia County, as far as positive tests that are of all the tests that are being recorded, are still hanging around 6.8%. So not a lot of change there. But it appears that the rate of testing is kind of out for the last couple of days. There was a little bit of a boom coming back off the weekend. So it's tough. It's tough to really interpret that in any meaningful way right now. And I think last week we made a mention that it's going to be one because they're closed for either half or all day because of the tornado warnings we had. So those are things that you look at them day to day, and you don't make a big jump in your assumptions based on that. As far as the state numbers, same. I mean, we crossed 15,000 positive tests over the course of the night, and jumped into 300 deaths over the course of the night as well, in 323. So that was as expected. We're flattening out quite yet. The surrounding states, Alabama, Mississippi, and Louisiana, are all projected to peak probably within the next week or so. And then Florida is looking at like the end of April, early May still right now. So I guess geographically, I want us to be clumped in those.
Yeah, my concern is this whole, everybody's cabin fever, and they're seeing that the things didn't peak as high as they thought they were going to peak in New York and elsewhere. And so people don't think it's as serious, and they get out too early. And then we have a second wave of this thing where it's equally distressing. And then we have to go back in our houses for another 3 or 4 months, and the whole summer's gone. And I just hope everybody stays vigilant, like everybody has been so far, about this until the officials say, okay, we have a vaccine, or we have a test, or we have this antibody thing that we can rely on. And we need to have a smart exit strategy from the social distancing, physical distancing thing that we're doing. It just doesn't need to just all of a sudden wake up, oh, it's Monday. So I think everything feels about right. So let's just start work again. That is not how we need to do this.
I mean, I for one, on an individual level, when I'm back working in the office there with you, I can tell you, like, every morning I'm going to have my same ritual of like, come wipe down the surfaces and, wash my hands frequently. I'll be doing that. And you'd like to think that every level moving up from there, like restaurants maybe aren't packing everybody in the same way that they had it, on a busy day. Maybe it's like, hey, we're keeping a table open. That some of the other more,
but I don't think
areas.
We should even get to that point though, Evan, until we've gotten some testing, made some strides with testing and treatment, so that we can at least narrow, the suspicious people. Like, if somebody has a fever, we need to know whether they have it or not pretty quickly. And, or if somebody has a sore throat, we need to know if they have it so they can stay home that day. If somebody wakes up with a fever, comes into work and says, I thought I felt okay, and then lunchtime they're like, I have a full-blown fever, they spread it to everybody in the office. But if they wake up at home and they have a rapid test they can do at home, or they can go do one somewhere that's really quick, they can stay segregated from society while everybody else comes to work.
I like that idea.
But we need to have that stuff we not only need to plateau, but we need to plateau and then have these things ready to go to help us get back going again. Because I'm worried that if we just get back going again, we're gonna do it too soon, and we're gonna end up with a whole second wave of this before we even get rid of the first wave, which is gonna be disastrous, I think, to not only the economy, but to our health and well-being, and both mentally and physically. So, well, I hope the best for that long-term I don't know why I'm having trouble with that, long-term care facility. I hope the best for those places, if it's more than one locally. I hope it's just an isolated thing. I hope it's not the tip of the iceberg kind of news.
It sounds like the Florida Department of Health is, as far as the response. So what I read is they're sending, and I don't understand what that means, like a grade 1, grade 2, grade 3. There's a team that's currently being deployed to work with this facility or facilities to hopefully enact some of what we were showing there at the outset here of, this is what we need to do to really cut this thing off. So hopefully that's going on. And yeah, I don't want to be I don't want the Escambia County or Pensacola to make news because
Right.
the next
That's the bad
20,
news.
20 people died.
No, that's not good.
That's not anything I want.
Especially when it could have been
So-
prevented by following the CDC regulations you just showed on the screen here.
Yeah.
All right. So what else do you have to share with us tonight besides the zinc?
Okay, so the zinc thing. So I spent a good chunk of my afternoon trying to get these links, and all this.
Right.
Like 15 minutes before we go on, Joe sends me a message. He's like, President Trump just mentioned zinc. You ready to talk about it? I'm like, okay. So
well, he threw another
so
thing out
go.
there. So it's
Yeah.
hydroxychloroquine and Z-Pack. Now it's zinc. I mean, it's like, good Lord.
So I'll go back to this here, and let's see here. So if I go to this
remdesivir,
that's an antiviral. So let's see here if I can get to this guidance thing here. I'm trying to, let's see. Okay, so I'm trying to get this. Oops. Let me get the other link out here just a second. And I have a better link that will take me right to where we want to go. Here. Oh. All right. And I found, so I'll talk while I'm doing this. So two things, the use of zinc back when SARS, this was, gosh, almost 20 years ago now.
Yeah.
There was what they call in vitro, and that means in glass. So in a laboratory in a petri dish, not in humans. There was a display that that zinc could, the zinc ion, not the pill, but the actual element, could interrupt the viral replication of its amino acids, which make up its RNA. So that viruses have RNA, we have DNA. So it could interrupt that replication process. So it doesn't stop the initial infection, but it was that it could stop the replication of it all. So when you go back to the CDC site here, and if you look at the alternative remedies, so I'm going to go down to the zinc here, and this kind of tells you what it was. So zinc was purported, and so zinc was purported as an immune booster, which is completely unrelated to virus.
Right.
Thoughts that it help your immune response to any kind of offending agent. But then also the SARS, again, almost 20 years ago, showed that it could inhibit the RNA replication. So my quick search, like 20 minutes before all this, was, the zinc could slow down perhaps that over-revved immune response we talked about last night with the cytokine response. Right. So it could put the brakes on that, and you'll see that thing down. Excessive immune response is suggested as being a reason why people don't do well. So this perhaps puts the brakes on that. So that's part of treating the host, like we talked about last night, not treating the infection. You're treating the host to try and slow them down. So there's an initial thought that might be, but then also with the anti-malarial drugs, there is in vitro evidence out there that this can help, that the drug itself, the anti-malarial, the hydroxychloroquine, helps to bring the zinc into the cell, and inside the cell is where the RNA is, and the zinc can then get to work.
So together, that's why it needs to be together.
That's the theory. I don't think that there's any proof out there.
So now there's going to be a rush on the stores for zinc, I'm guessing, and
probably.
And Zicam and all those things that have zinc in it.
Any of these powdered things that you take when you're like getting the sniffles, and you say, I'm gonna mix one of these things up and knock this thing out. So that's, and I'll follow this along and see. But again, just looking at some of these, they're completely they're not published, nothing. These are all theories that are out there. I mean, unless the president knows something more than we do, that there's a trial that's about to be released.
I sort of hope he does. Not himself personally, but at least people around him know stuff that we don't know. All right. So what else do you have for us today?
So the other thing I have is last night this came up and you had mentioned Chris Cuomo had made reference to some breathing exercises that he was
Right.
doing and how how that may be helpful. So I want to demonstrate that again. And of course, my mom's watching these things and she sends me a text and you know what she uses? Her Breathe app.
Oh, that makes sense because it times you going in and out.
Yeah, so she's been using that. So if anybody's got an iWatch at home, use the
Any
Breathe
kind of
app
smartwatch, right?
and set it to 5 or 6 breaths per minute. The little emoticon thing or whatever it is to try and get. So doing some research on this again, I just want to clarify that what we had said last night as well, where this doesn't stop. You're going to get done no matter how you're breathing. What this does
Right.
is helps you to best in tune and ready to handle the infection. So with some of these ideas of doing breathing exercises, the idea is if you're trapped at home because we're all on lockdown and I'm used to being active, you're used to being active, they want you to not be trapped at home and laying on the couch because then you're basically just waiting infected and you're going to get infected when you're really not in shape to be infected.
Right.
So the idea of doing any kind of activity and exercises, even before infection, is something that is being promoted at the board. In the event that you were to a positive test and you're a treat at home kind of a person because you're not sick enough to be in a hospital, thank Lord, then same thing. Don't just go home and lay it down because then you
Yeah.
get the collapse of the
That's what
lungs,
he was saying.
atelectasis.
Yes.
Yeah. So to that point, there was a question of what kind of exercises should we do, and so I pulled up some exercises here from the American Lung Association. That's the first place I
Mm,
would go for lung stuff,
sounds
right?
pretty credible.
And yeah, so we'll again here today, but I'll just show you. They keep this on their website at all times, and they've made reference to it in regard to the COVID, but not specifically on this page. They're just talking about the benefit of breathing exercises here,
Mhm.
and basically they walk you through it. And so if you don't have if you don't have the fancy watch, they got the pursed lip breathing, they got the belly breathing with
Uh-huh.
the diaphragm, and they tell you how to do all that, and they tell you that it takes some practice, and so they got
Oh, they have
videos on
little
here. So
YouTube
you
things.
yes, I'm
That's
in here.
great.
We'll share that link here. And so this is kind of targeted people that maybe have underlying lung disease. So
Right.
if you're at home and you have lung disease and you're just trying to avoid getting infected, doing these kind of things is very good for you. It's not going to prevent an infection, but on the chance that you get infected, then you hopefully are for it. If that makes the best sense. It's like training up for any other event in life or studying for a test. You go into a
Mhm.
test without studying and you're going to fail. So we'll share that as well. So there are
Oh,
some
great.
breathing exercises that are out there. So that was the last thing that I had there. I don't know if there was any
Fantastic.
other questions or anything else that was on in your mind or the headlines
I
you
don't
had seen.
think so. I don't think so. We, today's April the 8th. Is it 8th or 9th?
They
I'm losing track of the days. Yes, 8th. And we'll be back tomorrow, Thursday, April 9th. If you want to get us on the web, you can get us at zarzaurlaw.com. We're obviously still open for business. Everybody's working from their various locations, houses, home offices, whatever. And we're still seeing new clients. Car wrecks are still happening, believe it or not, even with not a lot of people out there. Other injuries are happening too. People are calling about medical cases and medical legal cases. And so you can reach us at 855-HIRE-JOE on the web at Zarzaur Law, info@zarzaurlaw.com, or you can comment underneath this video and we'll try to get a response to you. Dr. Malone will be back tomorrow with updated information. Hopefully that long-term care facility stuff is under control by tomorrow. And it's not the tinder box that we think it is. Anyway, we're here for you. Y'all take care and we'll stay well and stay home. We'll see you tomorrow. Thank you.
Thank you.